Danira and Philip have been trying to get pregnant for about a year and a half. We did a complete functional health evaluation on them, including blood tests, and we identified 2 significant roadblocks to their fertility. If you stick around to the end of this video, you will see a complete action plan that you can implement, as well as I have seen this exact same presentation in practically every single person that I've helped get pregnant and have a baby from the time I've been in practice. So stick around to the end of the video and you'll find out exactly how you can help your fertility as well. Danira and Philip.
Yep.
Okay. And I appreciate y'all consenting to, come out and get tested and everything else. I really like doing fertility.
Okay.
Because, you get a baby at the end if everything goes right. And I've had a lot of success with fertility because we take a really holistic approach, which I'll explain all that here later. But so how long y'all been trying to get pregnant?
Since last August.
Okay. So
Or no.
not even a year.
2024.
2024.
Okay,
August
so
2024.
like a year and a half.
Yes.
Or so.
Mhm.
Okay. And like, did you stop birth control at that point, or did you like hormonal birth control? Or
IUD.
Okay. That actually makes things a little easier.
Okay.
Hormonal birth control would mess you up. Have you ever been on that?
I was for just like heavy or bad cramping and heavy.
Oh, I
flow.
see.
But that was when I was
Not
like
for birth
a teenager.
control necessarily.
Yeah.
I see.
Yes.
Okay. So any other health complaints? I don't know, anything at all, like, oh, my back hurts, or I have headaches, or I have migraines, or
no. I've been seeing
stomach trouble?
No stomach trouble.
Okay.
I see
you
a
mentioned
chiropractor.
An acupuncturist and a chiropractor. Okay.
I do chiropractic work routinely. I go 3 times a week. And then acupuncture, I've been going every 2 weeks the start of this year. But before then, I was going at least once a month.
Okay, awesome. That actually makes my life a lot easier. Because like what I do, because I'm retired, is I don't adjust people anymore. All the stuff I do is designed for you to be able to do at home.
Okay.
It's not like come see me 3 times a week or anything like that. But one of the things that does help fertility quite a bit is structure. Like if your pelvis isn't right and it's affecting the nerves going to your uterus or ovaries or whatever, then that can cause some problems. So are you seeing the chiropractor specifically for fertility, or just in general?
Just in general for because of my work. Just being a dental hygienist. Yeah. So you do it for everybody, but he does adjust my lower back some.
Okay.
And,
okay, and pelvis and everything. Okay. And then you mentioned going to an acupuncturist. How often?
Right now I'm going every 10 days, the start of this last month.
Okay. And is that for fertility?
Yes.
Okay. And besides doing acupuncture, are they doing anything else? Like, take these herbs or do... Okay. And you've been doing that for how long? Since
almost a year.
Okay. Okay, that's a long time.
It'll be a year in March.
Okay. Like I said, we'll go over everything that we found already and do a bunch more tests on you. And I really think we've identified some significant roadblocks to fertility. So great. Okay. So, and that's one of the problems with fertility problems is like, it's hard to tell if they're working. Because maybe it's helping 90%, but that last 10%, so like back pain is like, I'm a lot better, but not quite 100% there, or whatever. You can feel it, but with fertility, it's not that way. It's like
No.
I got a baby, or I'm pregnant, or I'm not pregnant.
Yeah.
You know, it's like that. So, so it's a little bit hard to tell. Tell me about your diet?
My diet?
You're laughing.
We try to be intentional on eating 80-20.
But it's not like that.
When you say 80-20, what do you mean?
Like, generally speaking, decent food 80% of the time, and then 20% of the time we just eat whatever.
Okay, so great. What do you call decent food?
One ingredient foods. So,
okay,
rice, chicken, vegetable.
Mm.
Okay.
So protein, you know.
Yeah, like
one ingredient.
Okay.
But we've been terrible at that the past.
Since the holidays.
Yeah.
Okay.
Yeah.
Okay. So, like, you know.
So we'll go to Slim's. We'll eat out the majority of the time.
Slim's, where they deep fry food.
Oh, yeah.
Yeah. Okay.
Chicken.
Yeah.
We normally never eat Taco Bell.
But we had Taco Bell last week, and we had pizza. So it's not been good.
It's been terrible.
It's been really bad.
Okay.
But we were, you know, and then we'll eat like spaghetti, which we get the Prego, you know, it's not like homemade spaghetti.
Sauce.
Yeah.
Okay.
And then just meat and noodles.
Yeah. What's your meat?
Ground beef.
Okay. But like you both work.
Mm-hmm.
So it's like, oh, we're too busy to cook, or I just don't like to, or
I like to cook. It's
okay.
not a problem, really. It's just I've been traveling a lot with work.
Yeah.
So
yeah.
I've been out of town a lot of the time.
Yeah, commercial roofing, yeah.
Yeah. So
I'm a lot more worried about you.
I don't like to
Sorry,
cook.
guys have a significant role, but not like, you know, nearly as vital. But yeah. And we didn't do blood tests on you. I would have liked to, because you got to be around for the baby. We'll talk about what we found. Because if you would have said, oh, my diet's perfect, I would have been like, really?
No, it's definitely
not. Because it's not showing that, which we'll get into that. Okay. So this brings up a question, like, how willing are you to make changes in this area?
We're willing to do anything.
Okay.
Mm-hmm.
Okay, like
it's time.
I'm gonna do it.
Yes.
Like, I'd rather have a baby than this Coke or whatever.
Yes.
Okay.
Mm-hmm.
You ever drink Coke?
No, wait.
No.
Okay, great.
No.
Great.
I do drink coffee. That's probably my biggest.
Okay, there's coffee, and then there's coffee with
lot of
sugar.
creamer. Yeah.
Okay, there's creamer, and then there's creamer. So when I say that, like, there's the artificial junk that's like poured in with all the artificial flavoring and
the good stuff.
And then there's like, okay, well, I'm gonna do coffee with, you know, MCT oil, or I'm gonna do. Are you willing to change that?
I'm willing to give up coffee if that's.
You do not have to give up coffee.
I like to have a lot of sweetener.
Sweet coffee.
Yes, I love sweet coffee.
So she can't.
But I've gone through periods where I don't drink coffee for like a month or two, and then every now, like when it gets really cold, that's whenever I want it because it's something warm.
Okay, so would you say you have a sweet tooth?
Not really,
except the coffee.
Mm-hmm.
Okay, because sugar's a big deal.
Mm-hmm.
It's like a big problem.
Okay.
And we'll talk about that.
Okay.
Anyway.
Okay.
So, you know, and there's one of the nice things is like taste buds change, but they don't change on their own. You got to be a little intentional about it.
Okay.
Because, you know, sugar tastes good,
Mm-hmm.
you know, anyway, but you're willing to make changes in that area.
Yes.
Okay.
Mm-hmm.
Okay. So on a scale of 1 to 10, how old are you?
32.
Okay. Okay. So on a scale of 1 to 10, how healthy would you say you are?
I would say maybe like a 6.
Okay.
I work out consistently 3 to 4 days a week, but my diet is not there. My diet is probably like a 1. Like it's not good.
That's what's dragging you down the most. Okay.
Yes.
Okay. What would you say?
7.
Okay.
I think she's probably a 7 too. I mean, we're active, we move, we just eat on the go a lot of the time. So we'll get like, I mean, even Jersey Mike's or, you know, just fast food a lot more than we should.
Mm-hmm.
So you've been tested, is that right?
I got my testosterone checked. It was good. And then I also did an at-home sperm test, and it said it was good. Like all of my...
I'm not familiar with that. What does it do?
It tests like the motility.
It does test all that. Really? I hadn't heard of at-home ones.
Yeah.
Okay. Well, great. Then good. And
that was a year and a half ago, maybe. Or maybe a year ago.
Like I said, it's a lot easier when it comes to pregnancy to mess up the female system than the guy system. Sure. You gotta be in really bad shape and you don't look like you gotta have a gut, and you know, yeah. Anyway, and you know the other advantages are like, how old are you?
31.
Okay, you guys are in your early 30s, so this is, you know, youth helps a lot. Yeah. But the window's closing,
right?
You know, so getting after it. But I'm glad you're not, because I've had people come to me and like, I'm 44 and I want to have a baby, and I'm like, oh, you know, that's really, really rough.
I'm a miracle worker.
Yeah, exactly. So if your diet was like a 10, you feel like, oh, I'd be a 10.
Oh yeah.
Okay.
Yeah.
Great. So do you worry about like cravings or anything like that?
Yeah, I would say so. I mean, I've never had to watch what I eat because I've never had that problem.
Issue.
And so I've always been able just to eat whatever. So like, it is a little like, I know I will have to be more, just like more mindful of the choices that I make when eating. So
yeah. Okay. So you're going into this with open eyes.
Yes.
So how's your stress?
My stress?
Just normal life stress, not like my job is killing me or I need to quit or
no.
I think it's normal until we started trying, and then I think she put a lot more stress on herself.
Yeah.
But here recently,
we'll do some tests on that too.
We've kind of relaxed a little bit, and I don't think she's been as stressed on it, but you know, for the first 7 or 8 months, it was like every month, you know, it was hard on
Where
her.
are we?
Yeah. It was hard on her when she got her period, and so but I think, what do you think that's accurate?
Yeah, I think over time it's just been more like, well, I'm not as hard on myself as I was, or let down. Now it's still upsetting, but it's not as hard as it was.
So I don't want you to be like, I don't want you to be hard on yourself in regards to like, oh, I'm not pregnant yet, it's my fault. But I do need you to be, if you want to get results, I need you to be strict.
Yeah.
You know, and I'm talking about diet so far. I might find some other stuff. Do you guys take vitamins? You said you do. Okay. What do you take?
I take a prenatal vitamin.
Okay.
I take an omega-3.
Okay.
It comes with
how much is in it?
I don't know how much is in it. It's with it just comes in a bundle. It's with Needed. The brand
it's in
Needed.
Like a packet?
It's a capsule.
Okay. It's like a multi.
Yeah, you can look it up. But
so how many you take one it's a 1-a-day capsule?
It's a 2-a-day capsule.
Okay. And it's called
It's one
Needed?
twice. It's 1 and 2 capsules, like once a day and 2 capsules. Yeah.
So you like
the brand is called Needed.
Okay.
That, and I take vitamin D.
Okay. Do you know how much of that?
It's I should have wrote them all down.
Thank you.
That might be it.
Yeah, this is good.
couldn't find like a label with the ingredients.
It should be on there.
500 milligrams of omega-3 DHA EPA. Well, because I did test that for your blood, we'll go over that. Okay, this is, now it's saying something different, hold on. Delivering high potency dose of 1,000 milligrams DHA and 1,000 milligrams EPA, per 4 capsules. Okay, so there's 2, I get it. So 500 a day. Okay, well, that's a little deceptive. Anyway, we'll talk about dosage for that because you're taking nowhere near enough of that. And we'll talk about why and everything else.
Sure.
Okay, how do you sleep?
Pretty well, I think. I sleep through the night. I get 8 to 7 hours of sleep.
Okay, perfect. Okay, great. So, are you all hoping for a boy or a girl, or either way, or it doesn't matter?
Well, at this point, we want to help the baby. But I'm always team boy. I wouldn't know what to do with a girl, so.
Oh, I got 3 of those. I didn't get any boys, but I got 3 girls. They're great too.
Yeah, well, I wouldn't be able to tell them no, and I know that.
Oh, well, you got to learn that. Oh, my gosh. Yeah, they need discipline. Although boys, I'm sure, do too. I've never dealt with a boy when it comes to growing them up. Is she being needy?
That's okay.
She's fine. Okay,
let me give you a little bit of explanation on how we approach issues. And I would encourage you to, if you maybe if you want to fall asleep some night, you can watch my videos because they might put you to sleep. But anyway, I've got a bunch of videos on YouTube under AccuSmart.
Okay.
We look at things based on what we call the triad of health.
Okay.
And we look at 6 problems. Okay, and you're in the middle.
Okay.
And we look at allergies and sensitivities, like this food is causing me to react badly. Most people, when I say allergies, they're like, oh, I got a runny nose with pollen or whatever. That's not kind of what I'm looking at, although it's the same mechanism.
Okay.
We look at emotion, which we'll check that. Structure, which you're already addressing with the chiropractor you're seeing. So great. We look at your acupuncture system. We'll look at that from probably a different perspective, but you're already addressing that as well. So great. Toxins. There are certain foods that appear to have turned toxic for you, which we'll talk about that in detail. That's, I think, probably the biggest roadblock we're seeing. And then nutrition. Nutrition is probably the biggest category. It has to do with what you eat, what you drink, hormones, infections, prescriptions. And if any of these are trouble, let's say you're perfect, but your acupuncture system's thrown off and it's not working right, then that might be the linchpin that keeps you from getting pregnant. Or if the nerves to your uterus aren't right, same thing. So we want to look at all of this, and it seems a little complicated, but hopefully you'll when you're done, we'll have a whole action plan of what to do and how to do it and that sort of thing. Lady, you need to be good. One of the ways that we test is using muscle testing. Did Alyssa tell you about this?
No.
Okay. So your body's a lot like a computer. And you've heard of acupuncture. You get acupuncture. Different acupuncture points kind of mean different things to the brain. So we can do testing, kind of like asking your body questions about how different things are working. So I'm going to use your arm. You don't let me push. Come the switches, touch. There you go. You don't let me push. I'm going to push straight down, and you don't let me. Just hold it right where it is. Very good and strong. There's an acupuncture point right here. Hold really hard. Don't let me push. See how that's not as strong? You can tell a difference?
Yes.
Yeah, so try it again. Great. Hold really hard. Yeah, that's normal. This is kind of a circuit breaker point, kind of a shut-off point. So there's a couple other tests that we want to look at to see if anything is preventing you from testing properly.
Okay.
So there's a test point right here. This is an acupuncture point called kidney 27. Hold really hard. Very good. Now, a couple more tests. Don't turn your head, but look with your eyes. And then keep your eyes over here, and then sniff. Hold. Good. Okay. And I'm just going to push on this. If your arm gets tired, we can swap.
Okay.
Okay. Now, same thing, but follow my fingers with your eyes. Sniff again. Hold really hard. Okay. Try that one more time just to make sure. I don't want to catch you off guard. Look over here. Sniff. Hold. Okay. See how that one goes weaker? Okay. So this is kind of like asking your brain to do a lot of stuff all at once.
Okay.
Like there's like 3 different nerves that do this, and then you're sniffing through your nose and you hold your arm up, and your brain's being like, this is too much for me. Fixing this temporarily makes it so the testing is more accurate.
Okay.
So I'm just going to tap right here on this point, and this is just kind of getting, I don't know if you'd call it rebooting your computer, but just getting things right here. Good. Okay. Hold again.
Okay.
Hold. Very good. Same test. We want to make sure we got it fixed. Sniff. Hold. Can you tell a difference? Yeah. It's all good. Perfect.
Okay.
That's the way it should be. One more test. Put your hand over your belly button, just flat over your belly button. Hold really hard. Okay, and that's normal.
Okay.
That should happen. So good. Okay, so all the other tests we're going to do relate to like nutrition and that sort of thing. And again, if your arm gets tired, let me know.
Okay.
But this is for stress. Good. This is for close your right eye. This is vitamin A, potassium, sodium. Make sure I got that right. Yeah, sodium. Hold really hard. Hold really hard. Okay. Now, usually I make the assumption that that means you're low, but that may mean you're too high as well. Like you're out of the healthy range.
Okay.
So we'll do some more tests on that here. This is for trace minerals. Hold. Good. This one is for vitamin E, iodine, calcium, vitamin C. That is one of the things that your blood showed.
Okay.
Is that you're possibly low on vitamin C based on some of the tests. Hold. This is right on the ribs. This is your probiotics. Okay. Where's the bone in the front of your hip? There it is. This is for zinc. This one is iron, vitamin D. Very good. And you don't remember how big the D is that you take? Okay, that's okay. Where's your belly button? Right there? Is that right? Right below it is magnesium, and then touch your tongue. Just
touch it?
Yep, there you go. This is B complex. Very good. Okay, great. Now we're going to move on to organs.
Okay.
Close your right eye. Hold. Great. Now, that's the same point for vitamin A, but the eye needs A. So it has a little bit to do with your intention as well, but this is for lung, heart, liver, gallbladder. Good. Right on the ribs back here is kidney. Very good. This is small intestine. See how that one goes weak? Okay. So small intestine has a lot to do with a lot of things. I'm going to do a different test with what are called hand modes. And Dr. Beardall came up with these. He found that different hand positions relate to different problems in the body.
Okay.
So this is for parasite. This is for candida. Okay, and that's what I suspected based on the blood test.
Okay.
Have you heard of candida? Okay.
Don't know what it means, but I've heard of it.
Okay. It's like a yeast overgrowth.
Okay.
So have you ever seen thrush on a baby? Okay, that's like a form of candida.
Okay.
Kind of like.
Okay.
Essentially what it means is that your diet is carb heavy.
Yeah, I could see that.
And this, I'm going to make a note of that. This, I think, is a really big factor in fertility.
Okay.
But we'll get into that more here in a minute and double check all that. This one is for stomach. Oh, I forgot. I wanted to make sure I cover all my bases. This is for small intestine bacteria and then virus. Okay, great. Stomach. This is large intestine. Great. And then we're going to do the same tests. So this is for parasite, candida, bacteria, virus. Your arm okay? Okay. So the test was a little different. Your large intestine, when we asked the question, hey, how's your small intestine? Your body's like, yeah, problems right off the bat.
Okay.
Your large intestine said, no, I'm okay. But when we ask a more specific question, like, oh, is there candida there? Then your body said, oh, yeah, there's that there.
Okay.
Are you following me? It's kind of like being more specific with the test. Okay. This is for bladder. And then this is for uterus. Hold really hard. Uterus. Okay. And then we'll do the same tests. Parasite, candida. This is what I suspected. And here's the reason I suspected that is I see this all the time with infertility. Like classic.
Okay.
Classic situation. Let's make sure we're covering our bases here. Bacteria, virus, so candida. And again, this is related back to diet. So great, it's in your control.
Okay.
You know, you can do stuff about it. So anyway, you're looking skeptical or worried? I can't tell which.
Both.
Okay. So, and this is kind of weird.
Yeah.
This kind of testing. Yeah. Can you tell it changes your strength?
Yes.
Yeah. Here, come here a sec. Let's test you while we're at it. So in the 60s, I'm going to do the same kind of test. Hold really, really hard and straight elbow. Yep. Hold really hard. Very good. Same acupuncture point right here. Hold really hard. Try really hard. Yep. Hold. Okay, so like I can't test you. You're not testable. Let me grab something.
Why is that?
Well, so just like her situation.
Well, I feel like, I don't know, because it started to go down, but then I'm like, okay, I just need to hold it.
Yeah, hold it as hard as you can.
Okay.
Just hold it right where you are. Just like her situation where I had her roll her eyes and then I tapped her here. You may be under even more stress, and your body's saying, I'm doing everything I can to keep up with my stress, so I'm not responding to anything. Are you following me?
Yeah.
Yeah. So let's double check. Make sure you keep that elbow really straight. Good. Same test. Hold really hard. Okay. This is a vitamin that's called DSF. Hold that really hard.
Try to do this.
No.
Can you do this arm?
Yeah, sure.
Well, that one kind of hurt. All right. So what do I need to do? Just hold it?
Well, let's double check this side.
Okay.
Straight elbow. Same test. I'm just going to push. Great. Hold really hard. Okay. Not testable. Like you don't move. And you should with this point. This point should shut you off like a circuit breaker. Okay. So I'm going to have you hold this. This is a general vitamin that helps your body handle stress. So let's see if that fixes it. Hold. Straight elbow. Yep. Hold really hard. And you can tell. Can you tell it got weaker?
I feel like you just pushed harder.
Okay. Like, I can't push any harder. You're a stout guy. Hold. Like, I'm pushing hard, and you're holding up against me pretty hard. And, well, hold on. Hold really hard. No, I'm pushing hard. Hold really hard. So I'm not even pushing half as hard. Can you tell? I don't even have to.
Because I tried.
Yeah. Anyway, so this was discovered by a guy in the 60s. His name was, it escapes me right now. I'll think of it.
Okay.
Anyway, he found that acupuncture points and muscle testing kind of went together in a lot of ways. Mm-hmm. And it's been developed and expanded and, no, not Beardall, that's the hand mode guy. I'll think of it. But anyway, but it's normal to be skeptical because this is kind of a weird type of testing. Mm-hmm. It kind of is. Mm-hmm. We're not done.
Oh, okay.
But you go to the doctor and they do blood tests. Mm-hmm. And they talk to you and say, well, what's up? Mm-hmm. And all of this. We do all that same stuff, but then we do muscle testing on top of it. Mm-hmm. So it's kind of an extra layer of diagnosis mm-hmm. that we add that I think helps a ton because nothing knows more about what's wrong with you than your body and your brain. Mm. And if we can ask it, well, what's up with this? And what's up with this? And are you having this problem here? And so on. Then we can use that information all along with all the rest, if that makes sense.
Yeah.
Okay. Okay. That was organ. Now we're going on to endocrine, which is like your hormone system.
Okay.
Hold really hard. This is brain. This is pituitary. Very good. This is thyroid. Now, on the blood test that you sent me initially, they did a bunch of thyroid tests. Mm-hmm. Did they suspect that, or they just wanted to check it?
They just wanted to check it.
Okay. Mm-hmm. Okay. This is adrenal gland right on the ribs here. Hold really hard. This is very common.
Okay.
The adrenal gland, and that's what this helps. The adrenal gland is the gland in your body that most helps you handle stress. Mm. And you've heard of fight or flight. Mm-hmm. It's designed for short-term stress. Because the hundreds of thousands of years of evolution that we've gone through, most of the time our stress is fairly short-term. Mm. Like there's the bear chasing you and you died or you got away and now my stress is done. And you go about life. Mm-hmm. With modern life, you are in a situation where, I got a mortgage and I got a job and I got kids or lack of kids, they both stress. Mm-hmm. And, I got all this stuff that's this, I bought a car and now I've got 60 months I got to worry about it to pay for it. And then after that, I got to worry about maintenance and just stresses just add up. Mm-hmm. And it's not like one and done. It's like this long-term chronic stress that our bodies just can't handle. Mm. So we need a little help. So hold that. This is that same vitamin. Same test here. Hold really hard. See how you're solid there? Mm-hmm. Okay, drop that on the floor. Or, yep, that's fine. Hold. You can tell the difference? Mm-hmm. Okay. Mm-hmm.
How is it because of what this is?
That's a great question. Oh, yeah, well, that does have to do with it.
Or is it just because you're holding something? Could you be holding the phone? Or is it because this is like a stress relief?
Well, that's a great question. Have you ever heard there's an energy field around the body? Mm-hmm. They've proven it, finally. And let me grab a different vitamin. Like, same thing. Hold. Grab either one. Hold. Hold hard. So that stuff's called homocysteine, which isn't a vitamin at all. But swap out. Hold really hard. Okay, now just, you can hold the phone or whatever you want. And phones, depending on the situation, can have some problems too. That's interesting. Hold really hard. Set that down. Hold. Huh.
I got a stress relief phone.
Yeah, hold really hard. Yeah. Try it again. I'm holding it over your heart. Hold. See how your body says, I don't like that.
Mm-hmm.
Hold. So, and this gets into some stuff I wasn't necessarily going to get into, but the body's also binary, as in like ones and zeros, like a computer.
Mm-hmm.
So if she goes weak, she can't go weaker. She can only go strong. She can only change. It's a little bit difficult to get, but like, hold. We're asking a different question. Hold. Is the phone bothering her? Hold hard as you can. So the body's saying, I don't like this.
So it's messing with her energy.
Exactly. Grab that DSF again. Try it again. If we got her adrenals better, she'd better be able to handle this. But, and you noticed it made her strong when she grabbed it after I tested her adrenals. So it's like, hold. So we're at, say, 0, like no response, hold. Now we're asking, is this a yes, as in there's problems? Yes. Grab the phone. Hold. Okay, but we know it caused her stress, so she can't be like, oh, I'm weak, and then I'm weaker, because she's already weak. She can only go strong to tell us there's a problem with the phone, which can be a little confusing. I'm probably confusing you. You look like I'm confusing you.
No, I get it. It's just kind of hard to explain.
Yeah, it is. It is how the brain works.
Mm-hmm.
Yeah.
You can't do 2 no's, right? Like,
exactly.
So.
Yeah, exactly. I'm already weak. I can't get weaker. Sure. But then we're like, well, it doesn't make sense that the phone would help her adrenal gland. Well, no, it doesn't really make sense. So we test, well, is it making her weak without testing the adrenal gland? And it was like, oh, yes, it does. And do you spend a lot of time on the phone?
Mm-mm.
Okay, good. And, cell phones, you've probably heard they send off microwaves. They're not great for you. So anytime you can get it away from your body, the better.
Okay.
And it's not a huge worry. I'm not going to tell you to get rid of your cell phone. Just keep it away. And if you can do it like not right up next to you, that'd be better. But if we can get your adrenals to handle stress, that stress will not bother you. Okay. Hopefully. It's not even on my radar. It's not even a worry, but you asked about it. So yeah. It is a little bit of a weird. It's a little weird. It's a little out there.
Well, I've just never heard of it, so I'm just trying to better understand it.
Yeah, it's called applied kinesiology or muscle testing. And if you look it up on the internet, you'll find skeptics for sure. I have a video on it, actually. I'll try to send you a link that talks about the science behind it, because there's a lot of science behind it. Yeah. But anyway. Okay, let's keep going. Hold. That was adrenals. Okay. And then ovaries. Hold really hard. Hey, that's good. Hold hard. That's really good. Okay, leave this right here. Okay. This next test is to see, because your pituitary is the master gland. It's kind of the master gland of all of them. So this is to see if they're all talking to each other. Okay. So this is pituitary, thyroid, adrenals, ovaries. Hold really hard. Okay, that's good news. Okay. Because like when we get the thing that I was most worried about out of the way, we don't have that to worry about too. So great. Okay, great. I do want to test this. Okay. What kind of cooking oil do you use?
Avocado.
Avocado oil. Okay, great. Avocado is an omega-9. Omega-9s are fine. avocado, coconut oil, olive oil, great. Omega-9s. Fish oil, you don't cook with fish oil, but fish oil is an omega-3, which you're supplementing with. The ones that are the problem are the omega-6s. Omega-6s are normal in the body, but when we have way too many of them, then they become a real problem because if there's an excess of them, they become inflammatory. And inflammation can cause all sorts of problems. And they've linked it to heart disease. They've linked it to brain problems. It can relate to fertility issues, that sort of thing. And I'll get into some of that. But this is vegetable oil, okay? And it's an omega-6. Let's test, hold. I'm gonna hold this over heart. Your body's saying, I don't like this stuff. This concurs with the blood testing. We'll go over that in a minute. I'm going to hold this over brain, hold really hard. That's very good. I'm going to hold this over uterus, hold really hard. Okay, and let's hold over gut. Hold. Okay, so your body's saying, I don't like omega-6s. Here's the problem, is it's everywhere. They come from grains. So like if you go to any place that deep fries food, they use either a grain oil, which is usually a vegetable oil, or they use peanut oil, which is what most use. It's less expensive. And peanuts are horrible, but they're full of omega-6s. And then on top of that, you're in a situation where if you eat grains, they're in grains as well. So wheat, corn, soy, rice. I said nuts? Soy. Nuts. For the most part, nuts are good. Walnuts are particularly good because they have omega-3s in them. What the problem is peanuts. Peanuts are full of omega-6s, and they're not really a nut. They're grown in the ground. They're a kind of legume. So anyway, I'd stay. Nuts are great. Stay away from peanuts. So anyway, and then the other thing you got to watch is like.
What about cashews?
I like cashews. There's some theory that cashews are a problem, but not because of the omega-6s nearly as much. I don't worry about it. I don't worry about cashews.
So no peanuts.
Yeah, stay away from peanuts. Peanuts.
I like peanuts. I'll stay away from them.
Have you had pistachios? Do you like pistachios?
I don't like pistachios. I do like walnuts.
Okay.
I can eat walnuts. And what about almonds or almonds?
Almonds, they're great.
I like almonds and walnuts.
Tree nuts, they're fine for the most part. There's lectins in cashews, and there's some theory that lectins will tear up your gut lining. And when we're trying to rebuild your gut lining, which that's what we're going to be trying to do with you, then they say to stay away from those. But, you got to pick your battles. If you're staying away from peanuts.
I don't eat them all the time, but every now and then I like to have them.
Yeah. Don't.
Okay.
It's really, really bad for you. So I recommend eating a Paleolithic diet.
Okay.
And that's one of the reasons my wife isn't here. She's actually had a class at my daughter's fitness studio about how to eat Paleolithic and how to look at labels and how to go to the grocery store and all that. But anyway,
you know what that is? Paleo diet.
I've heard of it.
Do you like to eat meat?
We've talked about it.
Yeah.
Okay, great. So paleo's a lot of vegetables, lots of veggies, mostly, particularly in your case at the beginning, vegetables grown above ground. Vegetables grown below ground, potatoes, sweet potatoes, beets, although good for you. White potatoes, maybe not as much, but they're good for you, but they're full of carbs. Okay, and we want to avoid carbs because we want to starve out that candida that the only thing it can eat is sugar. So if what you put in your mouth feeds it, it's going to stay alive, and we want it not to stay alive. And we'll talk about how to fix that.
Okay.
This is encouraging to me because, like I said, this is a classic presentation. And when we get rid of the problems that you're presenting with, most people get pregnant.
Okay.
and I say that like it's really easy, but it's not. It's really, really, really hard, because the problems that you're having are so common in our society, because we've gotten to the point where, you know, you eat cereal for breakfast or a donut or whatever, you know, something like that. And then for lunch you have a sandwich that has wheat. And depending on the meat on the sandwich, you're in a situation where, you know, maybe it's deep fried, or it was maybe chicken that's been fed grains its whole life, so it's only got omega-6s in its body. And then you go home for dinner and eat pasta, and it's full of grains. You know, it's just never ending. Which again, we'll go over your blood tests here in a minute.
We're still not being successful with trying to get pregnant.
So have you considered IVF or anything like that?
No, we're trying to avoid that.
Yeah. I would avoid it if you can. And now that we're on the subject, let me go to that, because I'm going to go way down here.
But my point to that was, you know, we're willing to try whatever we need to try. We've been trying, you know, this way. Yeah. So
adding some extra stuff in, or subtracting, really.
Well, and then like the one thing that we really haven't tried is changing. We haven't been strict on our diet or trying to make healthier, more mindful choices, just because it's not something that we really think about, or we're just in a hurry all the time. So,
well, when we get to your blood test, you'll see why that's so trouble, and how it's affecting your fertility. I hope you see it. Talking about IVF, and you know, if you get a baby out of it, it's worth it. But you got to take serious hormones to do IVF, and they can seriously mess you up. The rate of success is between 34 and 42%. That's according to verywellfamily.com, their IVF clinic. And then usually what they say is the IVF cycle is about 12 grand. Now, this is a couple years old, and that's according to Advanced Fertility. But if you're paying $36,000, because they said the average one, it takes 3 cycles to be successful for the average person. But $36,000 for 38% chance of success, it's just really not worth it, I don't think.
And we don't have the money for it either.
Okay, yeah. And sometimes, you know, insurance will cover it or anything like that. But man, if you can do it without, you're going to be better off for sure. Here, I grabbed the wrong stuff. Can I test you real quick, just to make sure that things are good in that area? You want me to use your right arm?
I'm just sore. Like, that's why.
Were you working out?
Sore, yeah.
Sorry.
No, it's okay.
Okay. So hold. I'm not going to do near as many tests. Hold.
Do you want me to hold this?
Yeah. So we can test you, because we found we couldn't test you otherwise. So hold really hard. Okay, and that's normal. Now I know what that feels like when you're sore already, and then we're testing you. Sorry, but anyway, this is testicles. Hold really hard. Okay. So if that were going weak, I'd be worried about it, but that's not a worry. These are homeopathic samples of different foods primarily. And if your body has problems with, I'm inflamed because I'm sensitive to certain foods, it's best to avoid those.
Okay.
So anyway, there is a blood test that goes along with this. Hold really hard. Good. I'm going to hold this over your heart. This is our basic kit. That's good. You can do blood tests for the same thing. That is good. That's our standard kit. Same thing. And over here is good. If your body is overreacting to, these are all testing good. Okay, if your body's overreacting to certain foods, that are causing your, for example, uterus to be inflamed, then we want to avoid that, obviously. But none of that showed up. So good stuff. Toxins. I tested you. Well, no, I didn't test you for this yet. This is homocysteine. This has the potential. Everyone's body makes this stuff. This is good. It has potential for being toxins, but yours isn't. So good. That's a good sign. We already tested omega-6s, which were on my list, and those are toxic to you, but they're also nutritionally trouble for you. Okay, emotion. Emotion and fertility are very, very linked. You've probably heard that. And stressing about not being pregnant is not a good thing, for sure. I had a boss when I was in high school, and his wife was like infertile, had just a horrible time becoming pregnant. And then they adopted, and then she was pregnant within like 3 or 4 months because she was like, oh, I have a baby now. It's no big deal. And then she had 2. So great. But let's do some tests, and we're going to use muscle testing the same way. This is, again, an interesting approach because this is like testing your subconscious. Okay, so hold really hard. Just to give you an example, say I'm a female.
Say it. I'm a female.
Okay, and you believe that. Okay, and it's true, and your body says, yeah, that's true. Say I'm a male.
I'm a male.
Hold really hard. See how that goes weak? Okay, and your body's saying, no, that's not true. That's not the case. So, anyway.
I love my husband.
Hold really hard. Great. I want to get pregnant.
I want to get pregnant.
Perfect. I'm going to be a good mother.
I want to be a good mother.
Great. Hesitancy about that can cause infertility. I'm scared to get pregnant.
I'm scared to get pregnant.
Good. So that's your body saying, no, I'm not.
Okay.
Okay, great. And I don't test for stuff I can't help.
Okay.
So it's not like, well, yeah, you're scared. There you go. There's stuff we can do to help this.
Okay.
Okay. But we're not finding any so far. So great. That's kind of one layer. Let's do some more tests.
Okay.
Hold. There's 6 points on the body I'm going to test. Actually, let's swap arms.
Okay.
Hold really hard. These are acupuncture points. They're called B and E points, or beginning and ending points. Good. And try that again. Very good. Okay. All 6 of yours were good.
Okay.
Okay. Let's have you hold her hand. And actually, we'll go back to this arm because you guys are holding hands. Hold really hard. Great. Same tests. 1, 2, 3, 4, 6. Okay, great. That's a kind of a interaction between husband and wife that can cause some problems sometimes, but you're not having any of that, so great. So perfect.
Found a good one.
That makes a big difference, doesn't it? Yes, it does make a big difference when you find a good one. Let's move on to a couple more things. These are taken from this book, which is really good. It's called Feelings Buried Alive, Never Die. And I recommend folks read this because it does give a lot of insights. But you're not showing up for any emotion yet. So good. That's good. I had a lady who, she was pregnant already, but she was actually long overdue. Oop, I'm past it. She was long overdue on the delivery. And we did acupuncture for that because there's acupuncture points for helping the baby come, and it didn't work, and we couldn't figure it out. And she had a mother-in-law she was worried about her mother-in-law being just like this with the new baby and like controlling, and I guess the mother-in-law was already trouble, and she didn't want this whole thing to happen. And that was her emotion that was causing her problems. But yeah, it's fascinating how the body works, because that baby ain't staying in there, you know, it's got to come out sometime. But these are emotions that are subconscious that they found can result in things like, and I just wrote some of these down, endometriosis, fallopian tubes, and that sort of thing. So we're just going to go through these.
Okay.
So hold really hard. Deep-seated unresolved sadness, feelings of frustration, feelings of insecurity, lack of self-love, wanting to blame others for your problems, unresolved feelings towards mother, great. Negative feelings toward creative aspect of life, none of this is showing up for you. Really super. Oh, feelings of guilt, feeling the need to punish self, feeling the loss of someone or something loved. You're not showing up for any of that. Great. So the acupuncture points that I'm going to recommend for you are stimulated using this device, and it's got a AA battery. See how it says 1? So, and the energy, the electrical energy, goes out the tip and then through the body and back into the battery here. So it creates a circuit. Okay. So, like, I just barely feel that. Okay. The acupuncture points that I'm going to recommend are a formula for infertility.
Okay.
Because you're doing this, you get access to our fertility program with AcuSmart, which is, and I'm glad you have that, because I really focus a ton on diet in that. There's a general program that's with it that everybody does, and it's called the Functional Reset, and I talk a lot about everything on the Triad of Health, but diet's a big factor, and I do go into a lot of detail in there about diet and Paleolithic and avoiding grains and how to do it and that sort of thing. One of the things that you download is a whole book on how to stimulate acupuncture points and what points to work on. I recommend people do it about 15 seconds each point. And at this stage, because you're trying to become pregnant, usually you're in a situation where you want to do it every day. And I usually recommend, I'm watching the weather on TV and I'm doing my points, that kind of thing. So I'll get you one of these before you leave. Structure. Let's do a couple more tests that relate to this. So structure is mostly being addressed, hopefully by your chiropractor. You said they adjust your pelvis.
Yeah.
Do they like lay on your side or use a drop or?
I'm on my stomach and he just like presses down or like will kind of move my hips kind of.
Okay. Well, you've heard of it like a tilted uterus, that sort of thing. Okay. This is testing for that, which is not structure with the spine, but structure with the uterus. Hold really hard. I'm going to pull down twice and then push here. Hold really hard. Great. This one is more for like fibrous fallopian tubes. Hold. Try it again. Hold. Okay, let's try the right or the left. Hold. Okay. Okay, and I want to make sure that I'm not testing for something else. This is for parasite, candida, try it again, hold, bacteria, virus. Okay. One of the things that can happen, the fallopian tube is tiny. It's not very big at all. And when there is inflammation due to candida and omega-6s, one of the mechanisms the body always deals with when there's inflammation present is fibrosis, like, oh, I hurt my joint, I sprained my finger or my ankle or whatever, then to heal it, fibrosis occurs. And this is great, except when it shouldn't. And that is one of the things that seems to be going on in your case. Again, the online program for fertility, I have a video that goes into this. So, but fibrous tissue, like if you're, and it's, have you heard of fertility massage? Okay. You can do it on yourself. But like if you massage like this, you're not getting anything done. You're not breaking up. We want the fallopian tubes to be patent. They need to, you know, have stuff moving down them, or nothing's going to happen. So we need to be breaking up fibrous tissue. And I don't want you to harm yourself for sure, but firm, like that's probably a little sore. Yeah. When there's inflammation in an area, and this is, you know, a tendon that's very commonly, are you right-handed? Yeah. With your work, I mean, it's probably pretty inflamed in there. And that doesn't feel very good. But when you're working on trying to get your fibers broken up in an area and it's already inflamed, if you do it like this, because, oh, it's too tender or whatever, it's not going to do any good. You got to like get in there and get the job done. You're better off going like this for 2 minutes than like this for 20 minutes.
Can you do it too hard and let it cause damage?
The body's really tough. You can, of course, you can do it too hard.
But she's probably not going to hurt herself.
No, not likely. Not likely. I don't want you to do it every day. I would do it maybe twice a week. Give your body time to heal up. This, I doubt, is a big factor. And then the other thing is, once we get rid of the inflammation, then things are going to get a lot better in that area anyway. So, and you're not old, so one of the things that helps that is enzymes, and at this age, your body's producing a lot of enzymes anyway. You know, as a matter of fact, let me grab something to test. Hold. Grab that. Hold really hard. Okay, set that down. Try it one more time. Yeah. Okay, this is enzymes. So I'm probably going to, I'll write that down in recommendations. Enzymes break up fibrous tissue, and they do a bunch of other things. I take this stuff every day. Because when you're old, like me, you get stiff and that sort of thing. And when you exercise and that sort of thing, your body produces more fibers, and it produces more fibers. And then when you get past about 25, your enzyme production starts to drop. So it's a kind of a double whammy. You're not old by any means, but if you're in a situation where you have more fibrous tissue due to inflammation, breaking that up, and this is anti-inflammatory anyway, enzymes are. So if you're breaking it up with a massage and then doing the enzymes, that'll help. That'll help. Do you bruise easily? Okay. So one of the cues that you're doing it too hard is, okay, you're bruising. So if you're like, oh, I did this and I see I bruised myself, then let that heal. Let the bruise heal before you start again. Because I don't want you causing trouble, in that area. I'm not worried about it causing you problems. And I tested and I'm pregnant. We'll stop doing the fertility massage because you don't need it anymore. So anyway, do you have any questions on that? I'll write it down. You're just not showing up for tons of stuff that is not just related to diet. And that's good because diet's in your control. It's not like out of control, but it's also bad because our bodies we're designed to survive. And the things that help us survive the most are sugar and fat. Like when we're a caveman, I need to survive the winter. So I need to put on, in the fall, I need to eat lots of sugar and lots of fat. And that's not a big problem when it's animal fat and it's like apples off the trees. But when you're in modern society, that's like, you know, sweet coffee or soda pop or candy, and then bad fried food. Mm-hmm. Are you following me?
Yes.
Yeah. So, and the food companies use that against us. They're like, oh, I need to go over this with you. They use it against us as our, you know, it's our trap. It's our genetic trap. It really is. Anyway, for now, that's all the testing I wanted to do. So I appreciate it. Let's talk about your blood tests, because there's some really good stuff, and then some stuff that is a bit of a worry. I wanted to talk about a bell curve. When they do blood tests, they use, for the most part, and there's some exceptions depending on the test, but they use a bell curve to tell where the problems are. Mm-hmm. And when they compare you to everybody else, essentially, when you fall into this area, they consider you normal. When you fall into this area, you're one standard deviation away from the mean, past one, you're still considered normal. And then when you have 2 standard deviations from the mean, they consider this like disease. Mm-hmm. Okay. This has a number of problems with it, because we don't want to wait for you to have a disease before we do something to make you healthier.
Right.
You know, we want to basically squeeze in the ranges. And then, so some of the tests that we do, there's 2 different ways that I look at blood, and I'll go over both of them with you. Some of the tests that we do are a situation where we're looking at this, and then some of them are based on research. And that's mostly the omega-3/6 test that we're going to be talking about. That's mostly based on research as to what's healthy. Okay. We used LabCorp. You went and got your blood drawn with them, and they used this method to determine kind of where things are. And you didn't show up for lots of problems with when we look at your blood in this way. Mm-hmm. Your platelets were a little bit off, which we'll talk about that here. And there, we did a couple different tests. We did a complete metabolic panel and a complete blood count, and then we did a cholesterol test, which is like a lipid panel to test your cholesterol. And then we did one more that has to do with the omega-3/6. I want to talk about the first 3 first. Okay. Out of all of that, the first 2, you only had 1, and that was the platelets. So not a big deal there. Let's go on to your lipid panel. You showed up high with your cholesterol. Now, keep in mind, the range ends at 199. You were at 201. Mm. So not like, you know, oh my gosh, you're out of range horribly. It's just a little bit. But that's in the 2 standard deviations from the mean. So keep that in mind. And we'll go over that more here in a minute. And then your LDL, your low density lipoprotein cholesterol, was also high. Now that one is a little more of a worry, because the high range is 99 and you were at 120 here. Okay. So out of all the tests we did, there were 3. Mm-hmm. So not like, my gosh, you're gonna die there. However, let's go to the omega-3/6 balance that we did, and talk about that, because that's where most of your problems are showing up. Your trans fats are showing quite high. This is borderline high is what they say, but trans fats shouldn't hardly be in the body at all. Okay. And yours is...
What's the range?
Here it is. Trans. Optimal is less than 0.5.
So she's right there.
5.1. borderline, 0.5 to 0.7. High was 0.7 or greater. I don't like to see any. This goes back to the bell curve. We want to, if we want her to be healthy, we want to squeeze that in as much as possible. And I'd like to see her well within this range here. And I'm glad you asked this, because we'll actually reference back to this with some of the others. Because the trans fats are a worry. A little bit more of a worry are...
How do you get trans fats? What is that?
Okay, that's a great question. Fried food, primarily. Fast food, fried food. The food manufacturers use it because it doesn't break down quickly. It doesn't go rancid easily. It has a longer shelf life. So like you are in a situation where you eat something that has fat in it, but it isn't refrigerated, then how does it stay good? Well, one of the ways that food manufacturers use to make it stay good is bacteria don't break down trans fats like they do. It's the other kind of cis. It's I'm no artist or chemist, so keep this in mind. But here's your molecule, and like cis is like, okay, I got molecules on one side. They're on one side of this. Trans is a cross. In other words, it's on the other side. It's like this versus this. This is more normal for the body. This is like abnormal for the body. And the same goes for metabolism. For bacteria, the bacteria look at this and they say, well, we can't break this down, so we're going to leave that alone. So it can stay on the shelf forever. And then high heat will cause it to be trans fat versus this cis. So when you deep fry something, even if it starts out this way, a lot of times it'll become trans fat.
Well, what about just an egg? I have avocado oil and I'm frying an egg.
Yeah.
Can you fry it?
It's not nearly as hot, and the oil doesn't stay hot for, like, those deep fryers, they turn them on in the morning and sure, they're on for 8 hours or even longer. And, the restaurants, they got to make a profit, but they clean that stuff out regularly, hopefully. But anyway, so it's a couple things. Some food manufacturers use it on purpose, but then even if you don't do it on purpose, it can happen this way if the oil is exposed to high heat for a long, long time.
So main thing, just no fried foods?
None.
Okay.
And when I say that, fry an egg is okay.
Sure.
But like deep fried food, yeah. And I wouldn't do foods with coatings either. Because unless you're like, okay, I'm going to make it at home and it's coated with they make nuts into flour sometimes. Maybe coconut flour or almond flour. Have you heard of this? Okay, it's paleo. So if people are in a situation where or tapioca flour my wife uses, I wish she was here. She knows way more about that stuff than I do. Anyway.
We normally don't cook with flour.
Okay, great. So getting anything deep fried out of the restaurant is just like a no-no. They're just not good for you. And especially not good for you because of this.
Right.
Am I answering your question?
Mm-hmm.
Okay.
Yeah. Well, how are we going to get it down? But I guess you'll go over all that.
So avoidance is one way. And then we want to replace it. And I'll talk about replacing it with omega-3s. But if you're not eating it and you're eating something else, your body's eventually going to replace it with the new stuff. So there's nothing you can do to like flush it out quicker or anything like that I'm aware of anyway. But
yeah, well, let's stop it, So
absolutely.
What do we need to
yeah.
stop it?
So those are the main things: fried food, and then anything that has fat in it but is manufactured, like, this has a list of ingredients this long, like you were talking about single ingredient foods, that's a great way to look at things. Broccoli, single ingredient food, and then I'm using the avocado oil and some salt and pepper. You can't do better than that, or whatever. Do you like vegetables? Okay, good. That helps a bunch. I wish my wife was here. She's at that class, but have you ever roasted vegetables? And they just really bring the flavor out in vegetable. But okay, these two are going to take a little bit of explanation. Omega-3s, there's several types. There's EPA, there's DHA, and there's another one, ALA. With omega-6s, there's a number of types, but what we're worried about most over here is actually a breakdown product of an omega-6 called arachidonic acid. Arachidonic acid to EPA ratio, that'd be 13.45. So again, borderline high. And that one,
it's right there. Less than 5.8. It's at the bottom.
Yep. Okay. And again, theirs, I think, are too broad. I like to see these come in quite a bit. They showed you're low on omega-3s, omega-3 fatty acids. EPA is mostly important for adults. DHA is used a lot for building babies' brains. So having high this is really, really good. Yours showed up for 70. Optimal is above 100. You're between 60 and 100 here. You're at 70.2. So you're in this borderline category here. But if you're trying to build a baby's brain, that's important for sure. So having higher amounts of this, which this is a type of omega-3, that's going to be important. Do you have any questions on that? I know I went over a lot of that pretty quick.
No, I mean...
What to do?
Yeah.
Okay. We'll talk about that. One of the things I'm going to recommend that you do, and I'll write it down, but is right now you're taking, 500 milligrams a day, I think?
I think so.
Yeah. I'm going to recommend you take 10,000, so 20 times as much milligrams per day. Now, and that's a fair amount. That's a high dose.
Of fish oil?
Of fish oil, right. I recommend when it's this high that you take a brand that is liquid.
Okay.
They do something. I don't know how they get the fish taste out of it, but they have lemon flavored. And
what do you recommend?
There's a couple different brands. The one I like the most is Nordic. It's widely available. You can get it on Amazon. You can get it at, where Natural Grocers is?
Mm-hmm.
Okay, you can get it at Natural Grocers.
Okay.
The one that I usually get is 1,560 milligrams per teaspoon. So it ends up being, I can't think of it right now, 5.5 teaspoons or something like that, which is about a shot. So just once a day, you fill it up and do a shot. What's 10,000 divided by 1,560 on your phone?
6.41.
Okay, so 6.5 teaspoons per day. And what I recommend is getting a shot glass or something that size, something like that. And then that's it. Yep, that's the one. I think that's the one. Is it 1560 Ultimate Omega? That may be a little different, but that brand is good. Now, if that may be more than 15, 60 milligrams per teaspoon, I'm not sure.
Okay, but we just need to shoot for 10,000 a day.
Right, exactly. And it's a fat, so it'll stay in your blood all day long. So you don't need to dose it out or anything like that. You just figure out how much is 10,000 milligrams, fill it up to the mark on your glass, and then shoot it down and you're all done.
Okay. Do I have to take it with food or?
Does not matter.
Okay.
Whatever feels good for you. Like my wife doesn't like liquid, so she takes pills. But like with her pills, it'd be 10 pills a day. So it's a lot. That's why I usually recommend a liquid.
Yeah.
So anyway, and you go through those pretty quick. Like you'll go through that bottle fairly fast, but you won't need, and I'll write it down in recommendations, you won't need that dose forever. Okay. That's just at the beginning. Okay. But what that will do is displace all the bad fats that are here. This does a lot of things that are really bad for you, having trans fats and omega-6s excess. So this is using what we call a functional health analysis. And this doesn't analyze your omega-6s and your trans fats and that sort of thing. This doesn't do that, so it's not in here. But it does all the rest. All those tests where we found there were 3 or 4 that were trouble, we put into here. And what this does is it compresses in basically the sides of what we consider out of range. So you'll see a lot more out of range here, and some of these are mildly out of range like the yellow, and then some of them are much more out of range like the red. And I'll send this all with you. What I don't want you to do is read this and be like, oh my gosh, I have all these problems. Don't think of this as like, I'm having this trouble right now. Think of it like, if I don't do anything now, I'm going to have this in 10 years, if that makes sense. Okay. And that's why I like it, is because, man, if you can prevent stuff, you're way ahead of the game. One of the things that showed up was anemia due to B12 folate deficiency. And again, I'll talk to you about all this. Bone marrow production. There was some blood tests that showed that your bone marrow weren't keeping up. Now, that can be for a lot of different reasons. One of the issues with omega-6s is it's incorporated into your cell membrane. So the cell membrane is where communication occurs for regular cells and nerve cells both. And if your cell membrane is full of omega-6s and trans fats, then all the hormones, either hormones or neurotransmitters, they kind of work very similarly, can't attach well to the cell membrane. So communication doesn't happen as well. And then you're in a situation where your hormones don't work as well for ovaries. And we're talking about just the stuff that, you came in here for, but it also affects everything else in your body as well. And things just don't work right when you have that kind of problem.
I got a question.
Yeah.
So when I do cook my chicken, I cook it in avocado oil most of the time. That's not going to contribute to the trans fat.
No, it won't contribute to the trans fat unless you I'm setting it to 400 and leaving it for 8 hours and then I'm cooking my chicken. So it's not likely to contribute to the trans fat at all. And then it's an omega-9, and so it won't contribute to the 6s either, which are a problem.
Gotcha.
So great. So don't worry.
Well, I was just
about your avocado
oil.
Make
everything.
No, you can cook it in oil for sure. Yeah, and you're already doing the right thing with the avocado oil. So that's not a problem. Yeah, not a problem. If you were to use many people use vegetable oil and then they coat it in like wheat flour, before they.
No, we don't do that.
Okay. Yeah, great. And then, you're just contributing to the problem at that point. But you're way ahead of the game because you're already cooking in a way that is going to be easier. But it's hard because like sugar's addictive and bread's addictive.
Bread's my problem.
Okay, yeah, bread is they've done lots of studies that show it's seriously kicking your dopamine levels. And that's going to be a bit of an issue. Now, in the AccuSmart program, there are, I have a whole, because it's a problem for a lot of people, I have a whole section on cravings.
Okay.
And getting rid of cravings. And use your acupuncture, there's points in the ear. And I recommend doing it first couple times in front of the mirror. So you're like, okay, that's where that feels like for that point. And then you can be like, oh, I'm having a craving. I'm driving around and I really want that whatever. And be like, I'm just going to hit my points while I'm, you know what I mean?
Yes.
It can actually help that quick. But
how do you spell AccuSmart? Because I tried to look it up. Acusmart.com. Did you see the Fertility? Is that go up to the top, and there you go. Hit that the 3 bars, and then find conditions. Yep, there you go. And then should be fertility or infertility there. Yep, there you go. And then this is, an explanation page a little bit. But if you go to the blue. And then there's a couple different things you can purchase in addition, like some testing, but go to the bottom. There you go, the big blue box. And I used to be in your same boat. I had a candida problem bad. I mean, like pretty bad. I had large, small intestine, it's causing me problems, causing me real problems. And for the first 3 weeks, maybe a month, I'm like, I'm dying of starvation. I need carbs. I need, but once I got past that, I don't even have a problem. I hardly get hungry anymore. It's just not really an issue. And I feel so much better. I'm not inflamed anymore. Like, I can get up and I can work out and not be like sore for 3 days. And, it's just way better.
Okay.
Everything's better. It's just bread and sugar are a killer. They're really not good for us. And if we were eating them like they did in the 1800s, wouldn't be a big deal. But industrial farming has just made it so it's so abundant, so abundant. It's in everything. Like I was saying, breakfast, lunch, and dinner. So anyway,
what do you think? Should we maybe do like a parasite cleanse or like a heavy metals or anything like that?
I tested for both of those things for her, and I didn't find either one. The heavy metals these are homeopathic samples of heavy metals that I tested for, and I did test for parasites. Now I'm gonna recommend a candida cleanse, which I'll talk about that and how to do that here.
I don't mean to get ahead.
No, it's okay.
If I don't say it, I'll forget.
Yeah, no problem.
So.
Yeah, no, I'd rather you ask for sure, and we're gonna get into all that for sure because it's important. If you don't kill it, it'll stick around, and then your cravings will stick around too. And there's the problem: is it's a lot like having a broken leg, and I use this analogy a lot. But like, say you break your leg, and then you go to the doctor and he puts that kind of cast on that you can take off because it has Velcro. And after a week or two, you're like, I feel fine. My leg feels fine. But the doctor said 8 weeks, do it for 8 weeks because your bones need that time. Well, you take it off and then your leg breaks. You're like, oh my gosh, my leg hurts again. I'm putting a cast back on. And then 2 weeks later, I'm fine. You take it off. So you're cheating constantly. And if you cheat constantly, just like getting rid of candida, if you cheat, it'll stay alive if you just give it a little bit of sugar. So you want to not give it anything you want to be really strict for a while.
Okay.
Because if you cheat, a year from now, you'll be like, yeah, that guy didn't help me. And I just was starving for 3 weeks and he just pissed me off.
So when you say a while, is that 3 months, 6 months?
Well, after about a month or month and a half or so, you won't feel like, oh, I need carbs anymore. You won't feel that. I wouldn't ever go back to eating that way again.
Okay.
The way you're eating now.
Pasta?
No, never.
You never eat pasta?
Never. Now, here's the thing. There's substitutions for all of that. Like, have you ever had spaghetti squash?
Yeah. Well, actually, I haven't had it. I've heard of it, but...
Okay.
Yeah.
It tastes better than pasta.
I don't know about that. I have to try. I guess I gotta try it.
Yeah, it's full of carbs. It's full of sugar.
No,
and then it's full of omega-6s. So yeah, I never eat pasta. Now, when my wife and I go to Italy, we'll eat a little bit of bread every once in a while. And I have a really healthy gut. Like, I got rid of my candida and I take probiotics every day. I have a really healthy gut. So I'll cheat some.
Your body can break it down.
And it could always break it down. It's just what it used it for, because I don't cheat much, but I cheat a little. And that's okay. But at the beginning, it's like the broken leg thing. If you want your leg to heal, you can't take the cast off for a while, for that 8 weeks or whatever. I'm harping on that, but anyway, and you'll get to the point where, and I couldn't eat pasta now. I know how bad it is for you, and I like the taste of spaghetti squash better. I think it has a better flavor. Same with rice, like rice. They have cauliflower rice. Have you ever had that?
Do you like the taste of that better than regular rice? Oh,
yeah. Like, regular rice is just little carb nuggets.
But that's you telling yourself mentally why you don't like it. You've programmed your mind.
Well, if that's the case, then that's the case. But I don't know. I mean, we all get to like what we like. But if you can get to like the healthy stuff, you're better off.
I feel about, like, cake. I'm like, I don't want to eat cake because it does nothing for my body.
Yes,
so that's how you look at food.
Horrible for you. Yeah, exactly. Yeah. So, and let's say, you get really healthy, and I'm not worried about you as much as I'm worried about her, but you get really healthy and you're like, I haven't had pasta in 6 months. I'm going to have some pasta. Okay. No big deal. It's the, like, breakfast, lunch, and dinner where I'm eating carbs constantly is when the problem comes. So, and I hate to deprive people of stuff, but I love to see people getting healthy too.
Yeah. Well, we want to. We've talked about it enough. I mean, this is just the nudge we needed, really. And
I'm not finding other big problems. Like, I find, and this is why I tested so much, I find regularly women have emotions that are roadblocks to their fertility. I'm not finding any of that with you. Talk about easy, and then you're already getting rid of some of the other roadblocks, like, that may or may not have been there, like structure and your acupuncture system, because you're already seeing the acupuncturist, the chiropractor. So anyway.
Yeah.
Anyway, continuing on with the lab, cardiovascular health, that one is directly from the omega-3/6. Most study on this and how it causes problems is related to heart trouble. So, and we didn't do blood tests on you, but if you're in a situation where you're similar, because you have a similar diet, then, that would be the biggest worry longer term, is that.
My cholesterol was high 3 years ago, maybe.
Okay.
I haven't done anything different, so it's probably high or higher, maybe. I don't know. What would you recommend for that?
Same thing.
Just
if you eat a Paleolithic. Oh, and then omegas won't bring your cholesterol down necessarily. What brings your cholesterol down is lowering your sugar intake. So if you stop eating sugar, cholesterol usually goes down with it, especially the bad cholesterol. And then, are you working out? Okay, yeah, you exercise, weights mostly, or cardio weights?
Both.
Okay, great. So they've done tons of study on, I wouldn't take a statin drug for sure. I don't know if anyone's recommended that for you, but that's a cholesterol lowering drug. They've done study that shows if you exercise, you're way more likely to get good results at lowering your cholesterol than if you take a drug. So in general, and there's certain instances where it's needed, but if you can avoid doing any kind of prescriptions.
You need to quit eating so much chicken. Does that have anything to do with it? Or maybe eggs?
Oh, no. They've actually done study on that. When you intake cholesterol in your diet, it has very, very little to do with the amount of cholesterol in your blood.
Okay.
They've done, and I'd recommend you to check me out. Check me out on that. How much does diet affect cholesterol? They've done a lot of study on that. There's a great, because people have agendas on the internet, obviously, but there's a great website called PubMed, and it's a government website, and they publish tons of research, and it's just pretty like they don't have much of an agenda. They're just like publishing the research that's out there. So I wouldn't worry about chicken or eggs or, eating meat is good. One of the problems with chicken, though, is most chicken that you'll find in the stores are fed a grain diet their whole life, pretty much, because it's easy for the farmers to deliver to the chickens. And when I say that, don't get me wrong, I eat chicken all the time, and we don't go out and necessarily buy the free range or anything like that. Anyway, but your bigger ones are like bread, pasta, cereal, tortillas, chips, that sort of thing. And there's subs for all of that. Like I ate chips last night, but they were Siete brand. Mm-hmm. They're a seed flour, and they're deep fried in avocado oil. So it's the same feel and the same taste, but it's not got the bad stuff in it, if that makes sense. High blood sugar. And again, your blood sugar wasn't high on this test, but with the functional analysis, it showed that it was. Okay, that's a big deal. If your pancreas didn't show trouble, so that's good. Your pancreas is handling it. But if you have high blood sugar from your diet, eventually your pancreas is going to be like, I give up, I can't do this anymore. And then you got like pre-diabetes, and then it really gives up, and then you got diabetes. And that's made even worse by the trans fats and omega-6s, because your insulin can't attach. And then if you think you have trouble getting pregnant now, wait till you have that. The thing that I recommend the most to kill candida is oregano oil. Okay. Have you heard of that? Mm-hmm. Okay, let's have you stand. And we're going to test again. Let's go to small intestine, candida. Grab that. Hold. Okay, and then let's go to uterus candida. And hold. Okay, great. Okay, so that's testing that it would help. I'm going to recommend oregano oil. The brand that I recommend the most is called Healthy Health. Okay. It's really a good brand. They've got really good quality stuff. It's liquid. Do you like spicy food?
No.
Okay. That's fine. Put it in a capsule.
Okay.
And because this has a dropper in it, put it in a capsule and then take it. And you need to make up the capsules as you go. Don't make up like a day's worth ahead of time. They'll melt.
Oh, okay.
I had a lady ruin her purse by putting a bunch in her purse. And anyway, you can purchase oregano oil in the store in a capsule already, but what they usually have to do, because oregano oil is very potent, what they usually have to do is dilute it very much. They usually use olive oil or some other kind of oil. They dilute it so it doesn't burn through the capsules. But you can grab some capsules online, and then oregano oil, You can go to their healthyhealth.com, or you can get it on, they have it on Amazon.
What type of capsules?
I usually get the veggie capsules, but it doesn't really matter. They're aught size. They're called size 0. Or maybe it's double aught. Yeah, I think it's aught. Size, I think it's size 0.
So
just empty, empty capsules. You can buy those on Amazon too, or you can buy them. I think they have them at natural grocers too.
Okay.
But I'm going to recommend 3 capsules per day. That needs to be spread out.
Okay.
And you don't have to take it to work necessarily. You can do it like morning, and then when you get home from work, and then I wouldn't take it right before bed. Like I said, it's very potent. And if you take it right before you lay down for bed, sometimes it'll come up a little bit. So I'd take it like, maybe a little after dinner or whatever.
Why do you have to take it in a capsule? You can't just take it?
Oh, no, you can.
It's spicy.
It's very, very spicy. I mean, it's not like oregano like you put on a pizza or something like that. I'm talking like hot. And another reason I like it in liquid is you can use it for so many different things. Like if I have a sinus infection or I have a sore throat because I'm sick, you put a drop under your tongue where there's no taste buds, and then breathe it in past the oregano oil through your mouth, deep into your lungs, and then out your nose, and it'll coat your whole respiratory system. I'm talking like quick. I mean, like you'll notice a difference immediately, and it will. This stuff, I love this stuff. It kills anything that infects your body. It'll kill a virus, bacteria, fungus, or parasite. It kills everything. And you'll think it's killing you if you get it on your tongue because it's really, really hot.
I've actually tried oregano oil before.
Okay.
Mm-hmm.
Was it pretty spicy?
Yes.
Yeah. It's hot.
Yeah.
It really is. If it's not, it's been diluted. So
yeah, it was very spicy.
The other thing that I'm going to recommend is a probiotic. I'm going to recommend 3 capsules a day of that at a minimum. Even more than that wouldn't be too bad. Let's start with, let's say 4. And you need to look for something that has a high count in the billions. NutriWest, which is a company that I like a lot, they have a great product. Although you have to order that online and you got to go through their website and that sort of thing. If you're interested in ordering from them, let me know, because I can give you you have to get a doctor's prescription. I can give you my number. But like if you go to natural grocers, Garden of Life is a really great product as well, probiotic. And they're in the high billions. And usually you'll pay for that as well. They're expensive.
Okay.
But like I said, billions, because you've got trillions in your body, probably even now. Mm-hmm. You've got trillions of these guys in there. And we need to repopulate with the good stuff. One of the problems is you can't take these at the same time. Oregano oil is an antibiotic, and it'll kill off the good bacteria as well as the bad. Mm-hmm. So usually you want to take the probiotics at least 20, 30 minutes after you take the oregano oil.
Okay.
So anyway, usually that the oregano oil is going to be absorbed fairly well by that time. If you want to be safe, you could do an hour afterwards, and you can take like 2 in the morning, 2 at night on that if you want to. But like I said, don't take them at the same time. And you don't take this forever. As when you get rid of your candida. So I would do that if you're strict on your diet and you don't give it anything. We're talking probably 2 months. And I would say you're going to go through a bottle maybe in 3 weeks. That's a guess. I'm not positive. But I would say one's going to probably last you about 3 weeks. If you're not taking it and you're the only one taking it and you're doing 3 a day, something like that. Anyway, so vitamin C. Vitamin C is essential for so many things, and it helps your immune system. It helps collagen production. It helps everything. It's really very, very good for you. And the nice thing about vitamin C is your body will wash it out if it doesn't need it. Because it showed up on the blood test and the muscle testing, I'd say 4,000 milligrams a day. Usually those will be like 1,000 milligram tablets or capsules. And I would spread that out as well. I'd do like 2 and 2 as well.
Okay.
Because if you take 4 all at once, most of that's probably going to wash out and not be utilized very well. So you're better off spreading that out. But vitamin C is so important for so many things. There's another product of theirs that I'm going to recommend that is called Total Female. But if you click on it, it'll give you like ingredients. Sometimes they're proprietary, but yeah, there it is. It'll give you ingredients. Now, and some of this is pretty basic, like vitamin A and that sort of thing. But what really, really helps is when you get down to some of the herbs that are in there, as well as some of the enzymes. The combination of all of it is really what I think does a great job when they put it all together. But like I said, they're trying to get a result and not just, oh, you're low on E or C or whatever, take this one vitamin. They want to support that entire system so it works better. The Total Female, same thing, and this helps the whole female system. DSF is the vitamin that helps the adrenal gland. Vitamin C, it's kind of the same thing. Our bodies can't make it, so if you're not getting it from your diet, and most people don't get enough, you could cut down from 4,000 milligrams a day to, if you're taking in 2,000 milligrams a day, after maybe 3 months. Sorry, my chicken scratches here. 2,000 milligrams a day, but I would just stay on that forever. DSF, I've had lots and lots of people take this all through their pregnancy. DSF, I would take 3 a day. Do that for, the adrenal gland is hard to rebuild. Yours, I don't think is horrible, but I would do that probably for 4 months. And then cut down to 2 a day. And I would stay on that perpetually as well. The adrenal gland, like I said earlier, just gets beat down by our everyday lives. And if you're not supporting it, you're going to have trouble with it. Proenzymes, this goes along with the fertility massage. That's the thing I tested you for when we were talking about that. I would take 1 a day. This is a pretty powerful one, and those are capsules. And I would just do 1 bottle worth. Just 1.
Okay.
Electroacupuncture. Daily. And you'll be able to download it's a whole book of stuff that it treats, acupuncture treats. But if you look down, it's in alphabetical order. It'll say infertility. And just has a bunch of different points on it. That classically, over the thousands of years acupuncture has been around, have been documented to help infertility. And, oh yes, omega-3s. And like I said, Nordic is the brand that I like. But there's other good brands. Barlean's is a good brand, and if you're like, this isn't lemony. I mean, there's maybe a tinge of lemon. It doesn't taste fishy, but it's not lemony either.
Okay.
Barlean's, I think they add xylitol. So it's a little sweet. I don't like Barlean's as much because of that. But if you're like, I just can't get this stuff down because it tastes horrible, you might try that. Anyway, I'm going to recommend 10,000 milligrams per day for probably about 4 weeks. And then cut down to 7,000 milligrams a day for, I would do 4 months. Fats stay in your blood a long, long time, and they stay in your body a long, long time too. And that includes like trans fats and omega-6s and that sort of thing. So you have to consistently replace them with the good stuff. Like if omega-6s get into a cell membrane, the body is probably not going to replace those out of that cell membrane until that cell dies off. And is replaced by a new one. And so you've got to have this, like, I don't have any trans fats or omega-6s in my blood, and I've got lots of omega-3s for your body to use as good building blocks, if that makes sense. And then I'd cut down to 5,000 milligrams a day, and I would just stay on that dose forever. So there's 4 things that I recommend everybody take forever. One is vitamin D. You're already doing that. One is probiotics. One is omega-3s. And one is DSF or some kind of adrenal supplement. There's lots of adrenal supplements. And if you go into natural grocers and say, I need something for my adrenals, they'll have something. Okay. I like this better than pretty much anything they have because it has glands in it. And if you're trying to rebuild a gland, like, my adrenal glands are struggling and I'm trying to help them, the best thing you can take is that gland, usually. Okay. So, well, you're making my life easy because we don't have to worry about emotions too much, and we don't have to worry about toxins and other stuff that's on the triad of health. We don't have to worry about allergies. We're not seeing any of that stuff. So, I'm not making any recommendations related to that. I know this is a lot here. I know it's a lot of stuff I'm hitting you with. And, let's say you do all this, but you don't change your diet. Mm-hmm. It's probably not going to help that much.
Okay.
So you're saying...
it's like, get rid of the bad stuff and replace with the good stuff. Is what we're trying to do.
No rice.
Rice is full of omega-6s, and then it very quickly turns into sugar in your blood.
And so no...
What about quinoa?
Same thing.
Same thing. It's a
grain.
Okay.
Yeah.
No grains.
Yeah.
Okay.
Sorry. And, like if you're hungry, that's the nice thing on this diet is eat all you want. Just eat the stuff that's on paleo. So a Paleolithic diet is essentially like, here's your plate. That's supposed to be above halfway, like maybe like that. Eat meat, and lots of it. Eat all the meat you want. Just eat meat. Eat veggies. And for now, you don't have to do this forever, but above ground, in general, if it's grown above ground, it's got leaves and that sort of thing, it's going to have a lot less carbs than something that's grown below ground, like it's the root.
That looks like corn. We can eat corn?
No, corn's a grain. Sorry.
No.
Sorry. But eventually, this isn't going to be a big deal. Mm-hmm. And then the other thing, this is on a Paleolithic diet, It's a small plate with fruit and nuts. And for now, I would avoid the fruit.
Okay.
Because it's got sugar.
Mm-hmm.
And if, you're like, I'd love to have a dessert. Here's a great dessert, is coconut cream. You know what I'm talking about? Mm-hmm. You know, you get it at Walmart. Yeah, it's at Walmart. You don't shake it, open the can, and it's got this like white coconut fat in there. And you scoop that out, put it in a bowl, and put some berries on top. Berries have a flavor of fruit, but they have very little sugar compared to like a citrus or something like that.
Okay.
Yeah. Like blueberries?
Yeah, blueberries. Strawberries are pretty sugary. Blueberries, blackberries, raspberries, very low. For fruit, they're very low in sugar. So, and they're decent nutritional value. Strawberries have a fair amount of sugar in them. Same with other fruits like apples, and I'm not saying that stuff's bad for you. It's just for right now. You can, if you keep feeding Candida, it'll stay alive. It'll stay alive, and we want to not let them stay alive.
For 8 weeks, is that?
If you get if you get to the end of 8 weeks and you're doing primarily this, and or even a better snack is like, I'm going to eat nuts because they have some nutritional value in them, and then there's just no sugar in them at all, really, to speak of. There is some in pecans and some in almonds, but not enough to worry about. So, especially if you're being really good with the pasta and the bread and the cereal.
Do you have like a PDF or something of what we should eat? Like, this is what you can eat, or just basically what you can eat?
Yeah, and like, I want spaghetti. Go online, paleo spaghetti. What's
so
paleo?
Anything paleo?
Yeah.
That's what we should look up?
Yeah. And, be sure, and what's not on the menu? Sugar. Dairy. Now, let's say you want some dairy. I'm not worried about it.
Eggs? Is that?
Go crazy. Eat all you want. That's kind of here. That falls into the meat category. In general, dairy is mucus causing, and it's not good for the gut. That's why I say stay away from it, because you're going to be in this transition when you kill off what's inhabiting your gut and the probiotics haven't grown yet. We need to make it as easy as possible for the probiotics to grow in there. And things like cashews or beans. Beans are like, oh, well, can I eat them? Can I not? Some people eat beans in a Paleolithic diet, and I don't have a big problem with that. But beans have things in them that strip away the lining of your intestines. And if you eat them heavily when you're trying to replace with a good bacteria, it can make it harder. That's why I stay away from dairy.
So no beans?
Yeah. In general, if it's not a huge deal because it's not like they're not full of sugar or anything like that. So and they have great protein in them. So I don't worry about it too much, but it does make the probiotics a little harder to grow. And we want to have a good, solid growth of that stuff in there because it's so good for you, having good bacteria in there. Okay.
8 weeks. Well, we can do it for 8 weeks. Like, very strict.
Well, it's not likely you're going to have a baby at the end of 8 weeks.
Yeah.
No, I know. I'm just like a reset.
Yeah, a reset. Yeah, yeah. And then, keep going because at the end of 8 weeks, you'll be like, I'm not craving sugar anymore. Because unless you cheat, then you won't. Your cravings will go away pretty much. And don't get me wrong when I say that. It's genetically programmed in you to want it. Because sugar helped us survive hard winters when we were cavemen kind of thing, So it's programmed that way. So keep that in mind. It's not like, I don't have to worry about it anymore. You can still overdo it. But if you're in a situation where you're like, no, I want to, because I eat desserts every once in a while. Like the last thing my wife made that was dessert, she took dates and she pounded them out flat. And then she put nuts on top of that. And then she put this high, this low sugar coconut, like dark, not coconut, chocolate. Low sugar, dark chocolate, like 80%. Mm-hmm. I'm not up on chocolate too much, but she put this layer of stuff. And once you get to the point where you're like, my taste buds have reset, that stuff to me, dates, I mean, they're like nature's candy. You know, they're sweet. They got lots of sugar in them. And they're okay to eat once you get rid of your candida, because the fiber in the dates keeps it from getting absorbed like a soda pop or even bread. They've done, you've heard of glycemic index. It's how quickly sugar the product you're eating goes from what it is to in your blood as sugar. It's like how quick it goes. Mm-hmm. Like white bread is like immediate almost. It's scary. And wheat bread even. So
you don't eat carbs?
I eat carbs like this. Like I had this dessert.
Okay, bread.
No.
You eat no bread?
No.
Not even, so just none?
We don't eat that much bread either.
No, but
you're asking it like we eat it all the time.
We went to Olive Garden and tore some bread up.
So, okay, instead of Olive Garden in Fayetteville?
Rogers.
You know where Noodles is?
Yeah.
Okay, so I'm right down from Olive Garden in Fayetteville, anyway. If you go down the road to Noodles, and I don't know, they might even do this at Olive Garden, say, hey, I want to sub my pasta for vegetables. It used to be, it might be more now, but it used to be $2 extra to sub vegetables for pasta. So like, I loved the jalapeno lime chicken. And it comes with a base of pasta, but they took a bunch of vegetables. It was zucchini and broccoli and I think cauliflower, but they're steamed and they put it on the bottom, and then they put the regular stuff on top of that that's usually in your meal, and instead of your pasta you got your veggies. It's way better for you.
We don't eat Olive Garden that often either, so
okay.
We've had it once, and like it's been months since we've had it.
It's so good.
But yeah, okay.
I'm not as worried about you as I am about you. Okay.
Okay.
Great.
Thank you.
Yeah.
Yes.
Yeah. And if you have any questions, let me know, because I'm here for you for sure.
Okay. Well, I appreciate you. Thank you.
Yeah. Well, thanks for taking the time to come.
Yeah.
Well, thank you for your time. I know this is a lot, so.
Oh, like I said, I enjoy doing it. I'm trying to get my YouTube channel better and help more people that way. And you have such a classic presentation that if somebody was infertile and watching this, it's very likely if they did exactly what I told them, that it would help them immensely as well. So
nice.
Anyway.